hyperbaric chamber at the Hospital of the Good Samaritan. Patients undergoing treatment or surgery breathe pure oxygen in a chamber in which the air pressure can be raised several atmospheres. Current practice involves operation of the chamber at 2 to 3 atmospheres absolute, which is 15 to 30 pounds gauge per square inch. The percentage of oxygen in the compressed air remains constant, but the amount varies with the pressure. At 30 pounds, for example, the chamber contains 3 times as much oxygen and other air components as the atmosphere at sea level. The increased supply of oxygen absorbed by the tissues dramatically benefits certain types of patients, permitting surgery and therapy otherwise difficult or impossible. At the same time, however, the hyperbaric pressures intensify fire hazards. Fires start easier, they burn faster, and they're harder to extinguish. There is no quick escape from the chamber because of the depressurization time needed to avoid the physical effect known as the bends, an aeroembolism which could be fatal. For the same reason, there can be no immediate help from the outside. If a fire occurs, it must be fought by the occupants of the chamber. Until recently, little has been known about the burning rates of various materials at hyperbaric pressures, or the most effective methods for extinguishing such fires. In October of 1965, fire service personnel of the city of Los Angeles and the state of California, together with personnel of the Hyperbaric Research Center at the hospital, conducted a series of tests to learn more about fire behavior and extinguishment in pressurized chambers. Small-scale tests were conducted to determine the rate of burning of various materials at 1 atmosphere and at higher pressures up to 4 atmospheres absolute. Here is a piece of cotton fabric burning at 1 atmosphere. Burning time is 10 seconds. Here's the same test at 4 atmospheres. Burning time 5 seconds. This is ether burning at 1 atmosphere. Seconds. Ether again at 4 atmospheres. (26.5 seconds). This material, chemically treated to resist flames, is exposed to fire at 1 atmosphere. At 4 atmospheres, there is no significant difference in the charring effect of the flame-proof material. These and similar tests indicated that all materials tested burn faster at higher pressures, from 58 to 128% faster at 4 atmospheres. The flame-resistant property of flame-proof materials, on the other hand, was not significantly reduced. Untreated fabrics were tested for other factors, which might affect the speed of burning. Fabrics hanging vertically, for example, burned much faster than those in a horizontal position. This illustrates the importance of lying on the floor immediately if clothing becomes ignited. Full-scale tests using fully clothed mannequins were conducted at 1 and at 4 atmospheres absolute. This is untreated clothing burning at 1 atmosphere. fire to reach the mannequin's head was 63 seconds. And now untreated clothing burning at 4 atmospheres. For the flames to reach the mannequin's head, 8 seconds. In this test at 4 atmospheres, the mannequin on the left wears normal untreated clothing. The one in the center is wearing the same clothing as the first, with a flame-proof gown over it. The one on the right is wearing a flame-proof jumpsuit over skin-tight undergarments. The untreated clothing burned rapidly. The same clothing under a flame-proof outer garment also burned rapidly. The flame-proof jumpsuit was charred but unburned. Most of the burning which occurred was from the ignition source. This indicates that a close-fitting, flame-proof jumpsuit with skin-tight undergarments or no undergarments at all is currently the safest clothing to wear in hyperbaric chambers. Flame-proof materials are also indicated for bedding and other fabrics used in the chamber. Several conventional methods for extinguishing clothing fires were tested. This test at 1 atmosphere confirmed the effectiveness of extinguishing such fires with a blanket. The same method at 4 atmospheres, however, was ineffective. Carbon dioxide extinguishers proved ineffective at 4 atmospheres. In addition, their use is strongly contraindicated because of the danger of asphyxiation. Standard portable extinguishers were partially effective at 4 atmospheres, but would not be adequate for extensive fires. The most effective method of fire extinguishment at 4 atmospheres proved to be a handheld water hose. Tests with fixed water spray systems indicated that burning clothes and bedding can be extinguished effectively at 1 atmosphere. 3 nozzles more than meet the National Fire Protection Association standards for this 8 by 20-foot area. At 4 atmospheres, however, the system could not extinguish the same burning materials. One reason is that hyperbaric pressures diminish the spray angle, and thus the coverage, even with a pressure pump on the waterline to compensate for the increased pressure in the chamber. This is the the spray angle at 1 atmosphere. Here is the spray angle again at 4 atmospheres, with water pressure compensated accordingly. The narrower spray angle indicated a need for more nozzles to cover the same area adequately. A specially designed water spray system with a booster pump and 20 nozzles distributed over the top and sides of the chamber proved highly effective at 4 atmospheres. The great amount of water applied and the side nozzles, which reached areas obstructed from overhead sprays, achieved a maximum speed of extinguishment. As a result of these and similar tests conducted during the research period, several recommendations can be made. All static-producing clothing material, including underclothing, should be avoided. Chamber occupants should wear single-layer, close-fitting, flame-proof clothing. Other fabrics, such as sheets and table drapes, should also be made of flame-proof materials. In the event of fire, a handheld water hose will prove most effective if action is taken immediately. Although the water hose is the first line of defense, it should be backed up by a properly designed, fixed water spray system. This would enable outside attendants to activate the system to cope with the remote possibility that occupants might panic or become incapacitated. The fire behavior and extinguishment tests conducted at the Hospital of the Good Samaritan have not been concluded. The Hyperbaric Research Center is continuing the program to help assure that the advantages of hyperbaric surgery and therapy may be experienced in a safe environment.